Hi, my name's Joe Bellick, and I'm the founding partner of the law offices of Bellick and Fox. We support the mesothelioma community by providing first quality legal representation to mesothelioma patients and their families. We're proud to support the Mesothelioma Applied Research Foundation so they can continue the work that they do every day on behalf of mesothelioma patients and their families.
At MRHFM, we exclusively help mesothelioma patients and their families. It's all we do.
This is why we are proud to sponsor the Mesothelioma Applied Research Foundation and its work to fund mesothelioma research and provide support services and education for patients and their families.
Welcome to this episode of MesoTV. I'm Julie White, the Patient Services Director, and today I'll be speaking with Dr. Gabriel Lopez, who's the Medical Director of the Integrative Medicine Center at MD Anderson. Dr. Lopez, can you tell us about your role, please?
Yes, so I'm the Medical Director at the Integrative Medicine Center. The Integrative Medicine Center is one of the clinical centers at MD Anderson. When patients are receiving their cancer care at MD Anderson, they may get referred to the Integrative Medicine Center to help address different needs. And as medical director in that center, I oversee all the different aspects of what it is that integrative medicine can make available to patients, that including a number of different clinicians that have different areas of expertise across the whole spectrum of what would be considered evidence-based integrative medicine.
So today we're going to be talking about integrative medicine. Could you just give like a broad definition of what is integrative medicine and how it differs from alternative medicine?
Yes, so integrative medicine is focused on really finding out, where is the evidence and seeing how the evidence supports the perhaps, currently considered non-conventional approaches. And so there are a lot of different kinds of interventions out there that can span the concepts of what are complementary, alternative, integrative medicine. Complementary medicine is more specifically speaking to bringing together these non-conventional, non-mainstream approaches together with conventional medicine, not necessarily in a thoughtful way. But for example, let's think about massage treatment. So someone might say, oh, massage, I heard is, nice. So as I go through my, current, journey, as I go through my current treatment, I'll get some massage. Why not? Alternative, as a term, would mean that there's an expectation that perhaps the massage, in this case, might do something other than provide relaxation, might do something other than provide relief for muscle pain, tension. There might even be an expectation that massage could treat cancer. So for example, an alternative use of massage would be to say, oh, you have a tumor, let me massage that tumor and see if I can shrink that tumor size through massage. So that would be an alternative use and definitely not a recommended, not an evidence-based way to treat a visible tumor or cancer. An integrative approach would be to say, well, there's a lot of research that has been done as far as how to use massage safely during cancer treatment. I see that, someone is, for example, experiencing fatigue from their cancer treatment, or someone might be experiencing peripheral neuropathy or neuropathic pain, nerve type discomfort, numbness, tingling, for example, on the hands and feet secondary to their cancer treatments. And so there is evidence that massage can help in that case. And so recommending massage to help with fatigue, to help with discomfort from peripheral neuropathy would be an evidence-based integrative way to bring that less conventional treatment like massage into conventional medical care.
A lot of patients are interested. We hear a lot about herbals and supplements. What do patients need to be cautious of when taking these herbals and supplements, especially while on treatment? to ensure their well-being as well as their treatment efficacy of the maybe chemo immunotherapies that they're taking.
Yeah, so some of the concerns with herbal medicines are that they can have powerful effects, and some of these effects, especially if combined with cancer therapies, prescription medicines, can be either, for example, an interaction, so that there might be an interaction between how our body uses or eliminates the herbal medicine and how our body uses or eliminates a chemotherapy drug, for example, and that might affect how well that cancer treatment can work. It might make that cancer treatment be less effective, or it might increase the toxicity connected to that cancer treatment if, let's say, for example, that herbal medicine prevents our body from removing or detoxifying itself of that chemotherapy fast enough. And so then you can actually get more side effects. Some of the other concerns too are that some of these herbal medicines can cause direct toxicity to, for example, the liver or the kidneys. There might be effects on these body organs. There might be also increased risk of bleeding connected to the use of herbal medicines. And so, for example, quite often before procedures like surgery, medical teams will recommend discontinuation of herbal medicines and supplements to avoid any potential increased risk of bleeding associated with their use. Now, there's a lot of research going into how herbal medicines and these kinds of natural approaches can help support patient health, but it's definitely important, before starting any herbal medicine, to talk to the cancer team, which may include the oncologist, pharmacist, and if there's access to an integrative medicine specialist. These are all individuals that can provide more detailed information about what's safe, what's not safe to do.
So although they are purported as being natural, they're actually pretty strong medications, these natural supplements sometimes. Yeah. So you should always talk to your doctor before you start anything, you're saying. Yeah.
So natural doesn't necessarily mean safe. And some of the research that's been done also suggests that some of the supplements that we do have access to, let's say at a health food store or grocery store, they might, have claims that are, not consistent with what they actually are able to do. And there are specific regulations around what kind of language can be used on these supplements. And so, for example, some supplements might say supports kidney health or supports liver health. However, it's unclear if they're, it doesn't mean that there's actually evidence to say that these products will support liver health or kidney health. But that is the claim that as far as that claim can be made by these manufacturers. And so just to be careful that just because something says it does something, it doesn't mean that it necessarily is the right thing to do to help support that aspect of health. And one other point too is that there's been research showing that some of the supplements that are available might say that they have an ingredient, but might have completely different ingredients. So there might not even be what's on the label in that product. And sometimes it's not what's on the label that's of concern, but it's perhaps other ingredients that make their way into these products that might be unsafe and need to be, you have to be careful with that.
The dosing as well, correct? Sometimes if someone says, oh, a patient might hear taking such and such is good for you, and then it's not regulated, the amounts in some of these supplements that they're ordering on the internet or something. And we don't know what's a safe dose, and the supplements they're ordering may not have regulated amounts in them, correct?
Yes, correct. So you have to be careful with the dose, and not all manufacturers have the same quality control in terms of not just the ingredients, but also the dose. And so you might have pill to pill, you might have batch to batch differences in what quantity of that actual natural product or botanical or herbal is in that supplement. And so, for example, when there are studies done using herbal medicines, when we're trying to learn more about how herbal medicines can be, a part of, healthcare, part of, cancer care, The products that are used are very carefully regulated. The quality is highly controlled. And so, for example, just because there's been, let's say, a study that used one particular supplement doesn't mean that you can just go to the grocery store and buy a supplement of the same name and expect that it would be of the same quality or potency as what was studied as part of a research.
I know that's true with curcumin. There have been studies with that, but it's hard to know the exact dose, the potency, the safety. Yeah. Can you tell us how integrative medicine could assist our mesothelioma patients with some of the side effects? I know you spoke a little bit about massage. They experience side effects like pain, fatigue, anorexia, shortness of breath from either treatment or their disease in general. What are some of the things integrative medicine has that could help with some of these symptoms?
So integrative medicine, definitely can offer a lot to patients with mesothelioma as far as helping with supporting, their health, their quality of life, helping to provide relief for symptoms that might be either, pre-existing. So, not all of us, have, symptoms that are experienced during cancer treatment that are just from cancer. And so there are opportunities also that integrative medicine offers to help address some of those kinds of ailments that were already present before our cancer diagnosis. And so it really takes a very thoughtful approach to how to safely bring in these kinds of integrative medicine approaches during cancer care. And in our approach at our center, what we do is that if one of the oncology teams has an interest, identifies that a patient could benefit from integrative medicine, they get referred to the Integrative Medicine Center, at which time they will meet with one of our physicians and develop with the physician what would be considered their integrative care plan. And so we ask patients about what symptoms they're experiencing. And so, like you shared, pain, fatigue, anorexia. So when we learn more about those symptoms being present, some of the management of pain is a collaborative approach. And so we might collaborate with colleagues in pain management or colleagues in supportive care or palliative care teams who have expertise in pharmacologic management of pain. And from integrative medicine, we might then consider bringing in treatments like acupuncture that can help with joint pain, that can help with nausea, that can also help with other symptoms, hot flashes, headaches, for example, discomfort from peripheral neuropathy. Acupuncture can also help with massage, can help with musculoskeletal pain, and can also help with other symptoms, can help with anxiety, can help with low mood, can help with fatigue. And so what's interesting about the integrative therapies is that a lot of them can help with not just one symptom, but might help to provide relief for several symptoms together, and they can be safely combined with other approaches that might be medication based. But always important to make sure that when patients are considering an integrative therapy, that they be thoughtfully incorporated, and to make sure that it's safe for them to pursue that specific therapy depending on where they are in that stage of their cancer journey. So always important to talk to the oncology team, and if there's access to an integrative medicine team, to make sure that they're not just pursuing an intervention, but also having the people that have the right training in providing those kinds of treatments like acupuncture, like massage, like yoga, and have that experience in working with individuals who are on their cancer journey, and making sure that they're taking into account special aspects of their treatment history. So, for example, if someone's recently had chemotherapy, there might be low blood counts, there might be low platelets, low white blood cells, there might have been a recent surgery. What are appropriate, comfortable positions to be able to have our patients in, whether it's engaging in massage treatment or acupuncture or yoga. So just really have to be thoughtful about not just pursuing an integrative therapy, but making sure that these are thoughtfully and safely used, depending on where what your individual needs are.
And I was going to ask that question, which was saying that collaboration among providers is very important. And does your team collaborate with the patient's other providers? And you did answer that question. You're answering the questions. I had another question, which was how integrative medicine works to complement palliative care. And you kind of touched on that. So do those two programs work together?
Yes, yeah. So definitely the idea is that integrative medicine is truly integrated, and that it's not an alternative. It's not something to do that's outside of the conventional care or conventional health system. And so our goal is to, with integrative medicine, to partner with colleagues that are, let's say, the main oncology teams, but then also other consulting teams that work with supporting the health of our cancer patients. And so we commonly collaborate with palliative care. We collaborate with cancer rehabilitation teams, teams that are in pain management, also teams that work on psychosocial support for patients. So commonly we also collaborate with psychiatry, psychology, social work, chaplaincy, spiritual care. So we are, part of a bigger team, and at no point do we ever pretend to have the solution for everything using an integrative approach, independent of what other, health clinicians can offer to their patients.
I know that integrative medicine emphasizes patient engagement in their own healing. How do you educate patients about self-care practices, lifestyle modifications that can complement their medical treatments?
Yeah, so as I mentioned, with integrative medicine, there are aspects of using integrative approaches to help with symptom management, and then there are also additional opportunities in which integrative medicine can help support patients' efforts at self-care. And some of the main areas of self-care that we focus on and emphasize as part of integrative approaches has to do with the importance of appropriate nutrition, also the importance of exercise. I mean, exercise has so many health benefits, whether it's during or outside of cancer treatment, for helping with symptoms like fatigue, to help with our mood, to help with sleep quality. So many good things about exercise, and important to think about how to integrate it safely as part of the cancer and health journey. Other aspects of health that are focused on in integrative medicine, also looking at managing stress and anxiety, helping with low mood, the importance of sleep health. If we don't sleep well, that has negative effects on our overall health. If we're not sleeping well, we can be more fatigued during the day. If we're not sleeping well, we can be more irritable. If we don't sleep well, we have a tendency to make poor food choices. And then also, any other symptoms that are being experienced that might get in the way of these healthy habits, we also work on. Right? So if someone is having, for example, peripheral neuropathy, so neuropathic discomfort secondary to their cancer treatments that might cause numbness, tingling, or pain in their hands and feet, that might make it difficult for them to engage in exercise. That might make it difficult for them to cook or prepare healthy food. So exploring ways to help support health goals, taking into account, what are some possible limitations, or that would make it difficult to just kind of do these self-care things. So what's realistic, and creating those realistic expectations, realistic goals is an important part of how we partner with our patients in their self-care.
You've mentioned some of the services you have. It sounds like you offer a lot at MD Anderson. You mentioned acupuncture, massage. What are some of the other services you offer?
So at every not every integrative medicine center or integrative medicine program has the same services or same expertise as, but most integrative medicine programs do have some combination of clinicians with expertise in the area of integrative medicine that ideally are working together. And so we have, as part of our interdisciplinary team, We have, as I mentioned, our physicians. We also have a nurse practitioner, a physician assistant. We also have massage therapy, acupuncture, yoga therapy, music therapy. We have a physical therapist who helps with exercise counseling. We have a dietitian on our team that helps with nutrition counseling. We also have health psychologists, and so our health psychologists in particular partnering with patients and helping with areas of both psychological health, but also helping patients better find strategies to successfully engage in their self-care. And so we all are working together as part of a collaborative effort. And so I think we're very fortunate at the with the team that we do have. And sometimes when it isn't as part of a comprehensive cancer center, it might be more challenging to get together that integrative medicine team that can work best for you. But I think it's always good to work together with your oncology team to find that community of integrative providers that are providing that evidence-based approach and that can help best meet your needs safely on that cancer journey.
As research continues to evolve, what future developments or emerging trends do you anticipate in the field of integrative medicine in regards to oncology?
I think we've already had a glimpse into what the future of how integrative medicine is going to be part of oncology care. As in recent years, there's been more and more integration of integrative approaches as part of conventional cancer care guidelines. And so my vision for the future is that integrative medicine is not going to be considered non-mainstream. It's not going to be considered non-conventional, but that these approaches are going to be part of standard of care guidelines for supporting patient health during cancer treatment. Some of the recent guidelines that have been published, for example, the Society for Integrative Oncology published together with the American Society for Clinical Oncology guidelines on pain management, on management of anxiety and depression during and after cancer treatment. There are additional guidelines that oncologists look to called the National Comprehensive Cancer Network guidelines that include a number of integrative therapies as part of their standard of care recommendations. And so I think that's the future. That is, there's more and more evidence building through research to support, showing the benefits of these different approaches.
Yes.
That they'll become more and more part of mainstream oncology care.
Well, I thank you very much, Dr. Lopez, for your time today. And I know I've learned a lot, and I think our patients will too. And sounds like MD Anderson has an amazing program. And thank you for your time.
Thank you very much.